Welcome to SVL Free News and Views for Wednesday, December the 5th. It's a bright, sunny day in downtown Statesville. I'll tell you about what's coming up this weekend in Statesville. First of all, I want to thank our sponsors, Mitchell College, Randy Marion, Piedmont Healthcare, Blue Harbor Bank, Fast Fields, Key to Escape, The Escape Room, and Statesville Family YMCA. Okay, you see behind me the signs Scrooge and Marley and Scrooge and Cratchit. This week begins the Christmas Carol presented by Theater Statesville in downtown Statesville. You can get your tickets at theaterstatesville.com. It's a walking tour through Statesville. You kind of follow Scrooge. I'm one of the Scrooges, so you follow me through downtown Statesville to see the play. It's a very interactive play. So a lot of the tours have already sold out, but it's this weekend and next weekend here, and go to statesvilletheater.com. Okay, on today's show, it's a very special show. Mike Fuhrman sat down with current CEO of the Iredell Health System, Ed Rush, who will be retiring coming up in May, and he also joining him was John Green, the incoming CEO. So they talk about some of the challenges that are facing the healthcare industry, and also what they're doing about it to be preemptive to give better patient care and wellness care for those of you in Statesville and Iredell County. So let's take a listen to Mike Fuhrman with Ed Rush and John Green.
Ryan, I'm here today at Iredell Memorial Hospital with CEO Ed Rush and COO John Green. Gentlemen, thanks for joining us today.
Absolutely, for the opportunity.
Now, we got a lot to talk about today, but I thought we'd start our conversation with just a look back on 2018. Challenging year for anybody who's probably in the healthcare profession, but you guys have unique challenges as a nonprofit, so maybe discuss some of the challenges you've had this year, as well as some things that you think are major accomplishments.
I'll give it a start, and I think John and I recently did a series of employee forums, and I would say for the many years that I've done those, we've always talked about change in healthcare. I think the difference that I've seen most recently is the pace of that change and the uncertainty of that change. So I think that is really, as we went into this last year, that our fiscal year of 2018 just ended, and we had a successful year. We did, the organization did very well, but we continue to face the challenge of not just the pace of change, but not always knowing what the future rules are going to be as far as how we deliver health care, and most importantly, how do we get paid for that health care that we deliver. So we had to be very, I would say, flexible on how we change areas of our operations as well as our strategic initiatives and goals to be able to end up with a successful year. So I think sort of overall that was a theme that I saw, was that constant change, but be even more uncertainty than I've ever seen in my healthcare career. So
I think the only thing I would add to that is, we mentioned throughout the forums that it was a challenging year, but I also noted in those forums that over the next 10 years I'm going to say challenging pretty much every time I meet with the employees, because that is where healthcare is going. With almost 20% of the gross domestic product being in healthcare dollars, the target's on our back. We're a local nonprofit. We have a very low operating margin. We do very well with the funds we're given, but at the same time we have to accept that if $1 in every $5 in the normal human, household is spent on healthcare, we're going to be looked at a lot, and that's just going to continue to challenge us. And no one's looking to pay us more money over the next years.
Right, and you're in a competitive field in terms of staffing. You're competing with for-profit hospitals and healthcare entities for the best employees you can get.
There's a blessing and a curse to being at the crossroads. In many ways it's a blessing because it gives us the opportunity for folks to come here, but it also gives the opportunity for folks to drive from here to another location to work. And so we do need to have, quality benefits and quality pay. And we are seeing, the different organizations throughout Charlotte and Winston-Salem and Hickory, raising their salaries. And when that happens, we have to look to ours. So that is going to be a challenge for us. And that's going to be an ongoing challenge, especially when you're looking at an unemployment rate, almost 3%.
Right. And what about when you look at technological advances in healthcare? Is it challenging for a nonprofit to kind of keep up in that area?
it is. It's because all our funds are generated by the organization. So we don't get additional funds from the county or from other organizations. We get very little from donations or that sort of thing. We get some, certainly we get some, but not very much. And so we really have to generate those funds, as John said. We have to have a very modest operating margin because every dollar has to be reinvested. So examples were this last year we bought the latest technology for robotic surgery, and there had been a change in that equipment and the way it performed, and we saw the opportunity and heard from several of the physicians that if we had that technology, it would allow a lot more people to stay local, and so we implemented that, and we got the support of our board to invest in technology like that. So I think that's a great example of where, but we have to balance that. We can't be all things, and so there are certain technologies that really, if you can't have enough volume to be quality and be good at it, and then to generate enough revenue that you could pay for that equipment, we really can't invest in that. So we're pretty good at that. We've watch our capital budget very closely. We have our finance committee meets right here in this room once a month, and they challenge us. And at the same time, John's been very involved in, we still have to do things like replace new chillers so we have good air conditioning equipment and for the building, new electrical systems, other life safety things that we continue to have to fund that you get done, and nobody but John and the engineering staff know the difference. But if we didn't do that and we didn't have the right temperature controls and that sort of thing, it'd be a big issue. So technology for us is very broad and very, very expensive.
I think it's interesting. It's probably some of the most spirited conversations we have, when we look at, where are we going to spend our capital dollars? Because every department has a wish list. Every department has items that they would, love to see to advance what they have in their area. No different than home. We all have those at our house, and so what we have to do is we have to balance, recognizing keeping the building in adequate to nice shape, so that we can house folks here. But at the same time, what technology, as Ed described, would be useful for us to continue to advance to.
One thing I'd like to mention too that I forgot on technology is the electronic health system that was a requirement of the Affordable Care Act. Well, actually it was before that. It was a separate act that did that. But it was an initiative that was put out, and which I understand. There was a need to move from paper charts to an electronic version of those charts. But the speed with which the industry was required to implement that, and although there was some federal funding for that nowhere near covered the cost for us to do that. And the interesting thing in healthcare is electronic, or the IT, the information technology, has not allowed us to reduce staffing or reduce other expenses. It's just really added on to the expenses. At the same time, our reimbursements have held the same. So, and we're not alone in that. Every hospital, every physician group across the country has spent billions of dollars over the last few years on that change. So that's a new thing that hit us in the last 5 to 8 years that's just dramatically increased our capital budget.
And that's happened during a general economic downturn.
Exactly.
Right.
Mm-hmm.
And those are costs that are not going to go away.
Right.
We had a capital expense to put it in, but now we have additional operating expenses every year to maintain it.
And it's not a cost you can pass along to the patient as a technology fee.
Yeah,
Right.
Our fees are pretty much fixed. They're
Right.
and those are just required to be absorbed in what we get reimbursed.
Okay. Well, Mr. Rush, first of all, I want to congratulate you on your upcoming retirement. You're going to work through May, and want to take this opportunity to talk a little bit about what you see as the major accomplishments of the health system beyond what we've already talked about, during your 15-year tenure.
Well, I think we've really tried to focus in on several things that that we identified, that the administrative team identified as important. So first of all, I would say this isn't about things that I accomplished. It's about things that the board, along with the overall management team and really all 1,600 employees accomplished. So, but most recently, I think our focus has been a move from just the traditional way of providing healthcare services, where someone gets admitted or has a surgery, and we bill for that procedure or that test or whatever, and we get paid for that. To begin to move, as the country does, to what's called population health. And so we're trying to put in place the right systems and the right knowledge base so that we can help to reduce the cost of healthcare. And what's kind of interesting about that, and been a challenge for the industry, is, so if you think about it, where is the most expensive place to get healthcare? It's at the hospital. So we're spending our time and energy, a significant amount of it, and resources on trying to reduce the amount of people that come to the emergency room, except for those that really need emergency services, to do preventative care so that they can avoid those expensive surgeries and tests and procedures. And when we do that, we're actually reducing our volumes and our as you compare to your previous years. So our team's work and effort in beginning that transition, when we didn't really have to at that time, in the sense that that movement hasn't really hit Iredell County heavily yet. So that's number one that I'm particularly proud of as we began that education with our physician partners. And the second thing that I see that we've done that's kind of different from the way I worked in healthcare for so many years was working with business and industry and having providers that are either physicians or nurse practitioners or physician assistants actually on site. And so we would have a primary care physician that would be there, or a provider that would be there. And we have certain businesses that people actually can just get off the production line, briefly come, see that individual, just number one, get a baseline, number two, kind of get updated. Are they having trouble with their meds? Their blood pressure still under control? All those things, and quickly get back to work. And we did that. We've been in the wellness business before I came. Certainly we had wellness nurses, but nurses on site. We've evolved that into a higher level of care that I think has been extremely important to business, to local business and industry. And so I'm particularly proud of our focus on not just taking care of people when they're sick, but preventing them from getting sick, or maybe not as sick as they would have been if they wouldn't have had that primary care. So I'll stop there and let John add, but those are some of the things that, as I see just this movement we've made, that I'm very proud of what this organization's done.
I would probably look to, a couple things. One, I always look to the building because, as he described, it's one of the things that I've worked on for a long time, and I look to the significant changes of procedural capabilities we have here in the building. I look at our cath lab, I look at the interventional cardiology capabilities, so somebody that's having an acute heart attack can remain in this community, can get a stent and go home the next day. That's a dramatic improvement from somebody having to go in an ambulance for 45 minutes down the road and hopefully be okay. I look to radiation therapy. I look to the capabilities that we have, in that area, and the fact that somebody that's going to have 6 weeks of radiation has the capability of getting that here in town and having a 5 minutes away from home, and then 5 minutes back to home, as opposed to, again, an hour and a half or 2 hours. And I look to those from a capability standpoint as huge. The other thing I would hit on, and Ed's probably going to talk about it later, so I'm taking it away from him. But we recently changed our mission, vision, and values, and I think that was a huge undertaking, but an extremely important undertaking. And so as we re-looked at it, and we looked at it with community members, board members, employees, and management team members, to say what really is the mission of our organization. And we took it from a page-long document that was way too complex and no one could recite it all. to basically three simple words, to inspire well-being together. And really that is the direction that we need to go as an organization, and that's one of the things that I would say is very important that it's been accomplished with Ed and I here, but really it's because of 1,600 people A, coming up with the idea, B, embodying it, and that's where I think the important stuff.
Well, I think that's a pretty good legacy for you, Mr. Rush, and obviously an accomplishment for your whole team. I know you don't like to think of it as legacy, but let's talk a little bit about the transition. The health system announced back in February that you'd be retiring and Mr. Green will be taking over as CEO next spring. Tell us a little bit about what the transition has been like and what's your focus been during this time?
Okay, let me jump in and start, and then I'll let John talk a little bit about how the transition's been going, it's gone extremely well, but that's jumping ahead. But so I think that one of the unique things and one of our huge strengths of this hospital being an independent, freestanding nonprofit is a local board. So we have 15 board members, all kinds of business backgrounds and service backgrounds and commitments to the community. And these individuals put a lot of time in this organization to oversee all the things that we do. And so what I did was, it was really well over a year before we made the announcement, I began to look ahead and realize that it was time, honestly, for this organization and for me, but really was time that we got a different individual here. I think I will have been here just short of 15 years when I leave the organization, and I think it's a time that they have somebody take over that can take the things that they agree with that I've done and add a lot of new, fresh ideas and take us forward. And so the beauty of it is, if you're not in a corporate environment, you're working with the community board. I was able to approach them early on and with full trust and no concern at all to say, this is where I'm thinking. And I know it's too early now, but let's start that process. And we did. And I encouraged them strongly to first look internally, because that I knew the talent that we had here and that we could fill this position internally. But it's not my decision to make. It's absolutely a board decision. So they went through a very thorough process of identifying the internal opportunities we had, or the internal talent that we had here, and selected John, and then allowed us to have what I would consider an extended, if you will, transition period to get it right and to make sure that we have the time to hand off things and give John the opportunity to take those on. And I would also say that we are, because we're, John mentioned earlier about our margins are not large, and so we have to watch all of our expenses. And so, when I leave, they are now going to be positioned with an administrative team that's strong and already set, so that they will not be, in effect, down one administrator and have to go rehire and do all that. So there's a lot of positives to the way we approach that. And I always told the board that, and tell other employees that, my success really will be that I walk out of here and the next day it's not even, it's not who's at, where's at, and not who's at. It's like, it's just, we're going on business as usual. But business as usual, I want to emphasize, is going to be different than it was under Ed. I mean, that's just the way it should be. John's already reorganized certain things, and I'm very supportive of those, and got new ideas and some great things going on. So I think that, I don't think that would have been possible without the support and trust of the board and the leadership of the board going forward. And I would add that, I think it's important to know that the board was prepared. If they didn't come up with a decision that John was the right one or to lead the organization, they would have started an outside search, and we'd be in the middle of that right now going forward. And it wouldn't have been as good, but it would have been the decision that and I would have supported that decision. So I think having that working relationship with them and that trust and their knowledge of this organization is amazing. I mean, we can talk about the strategic plan, and I would dare say you could get certainly any of our board leadership and most of our board members that have been with us for a number of years, and well, any board member, I would say, could articulate the very basics of our strategic plan and where you're headed. And I don't know that there's a lot of organizations of our size and complexity that could say that right now. So I'll stop there and see. And then I think it's gone quite well. John may feel different, but it's gone. But I'm still the CEO, so if he feels different, it doesn't really matter, does it?
No, I'm going to disagree with that on this one. A, we will say where's Ed, the day he leaves, because we're all going to be somewhat jealous and excited for him. I think the transition has gone over really well, though. We're very pleased. I think that one of the first things we did, the day after I was named, actually, I walked into Ed's office and said, now we're going to hire a vice president of Physician Network. So up until this point, the Physician Network had reported directly to Ed, and it grew substantially, under Ed. So when the VP that had the Physician Network prior to Ed taking it over, there were 7 physicians, in our network. Now there's 18 physicians in our network. And so you look at the difference between 7 and 18, and that happened while the CEO also had just a couple other tasks to do each day. And so, this gave us, having the internal transition gave us the opportunity to do something like this. You wouldn't be able to do that with an external person. So we had the opportunity to go out and to look for the best candidate to assist with the Physician Network. We brought Harold Brown in. Harold came in over the summer from Lexington, Kentucky area, and has done just a fantastic job. And what that is doing is that's allowing, he and his team to get out to all the practices and really to start to, well, not to start, but to continue to build even a stronger network and capabilities. And that's just a simple example of where, the transition can help us get to be even a better organization, because that's the goal. The goal has to be that each one of us builds upon the other, regardless of what our position is.
Well, just to add on to that question, and your answer may go beyond the transition time, but tell us some things that you've learned during your time working alongside Mr. Rush.
Now you realize he noted he's still the CEO, and I'm responsible to him, so these will be couched with that knowledge. No, Ed has been a great leader and mentor for this organization. We've been blessed here. If you look at the history of Iredell Memorial Hospital, we've had 4 CEOs in 65 years. And that's unheard of, in healthcare. The average healthcare executive doesn't remain in a position more than 3 to 5 years. And so for 4 in 65 years, and honestly, the one individual built the building and was basically gone. So it really was 3 in 64 years. That's great tenure. So, Ed is really on the short end of that, only being here 15 years, but we won't.
He's underachieved.
That's right.
I'm glad you brought that up. But no, I think what you can see from Ed, though, is he's absolutely been a people person. He's been willing to walk and talk. He wants to hear everybody's input. He has an open door policy, which is this cliche that everybody's heard from the 80s on, but it's absolutely true here. We talk about in other facilities, administration kind of is cordoned off into this hidden spot, and and we live in our own world. Ed's office is on a main hallway. My office is on a main hallway. There's a reason for that, and the reason for that is we want to be interacting, and he's helped shown that to us, and he's helped teach us that. Ed, very kindly noted, how the wellness and the business and industry work is something that he's very proud of that Iredell has done. I mean, he was the driver of that. He recognizes that is a difference maker for us. That gives us the opportunity to really be passively marketing every day, because your name is out in all these locations, and that's a great way to be. So I think those are great examples. I think he certainly leads by example. He certainly leads by consensus. He's going to go around and he's going to talk through a problem, which a lot of leaders don't feel the need to do. They feel that, they, as CEO, I have the opportunity to tell you what you're going to do. That has not been, Ed's style at all, and I think that is going to be, a success for us moving forward to continue to remain in that style.
Well, let's look forward for a minute. 2019 and beyond. What are the major challenges? Anything new, different on the horizon?
So first off, this is the first question I got to answer
That's
first.
right, geez.
I just wanted to note that. So moving forward, I think the challenges are very similar. I think that we're going to be challenged by, continued reimbursement cuts. We are going to be challenged by a healthcare design, as Ed described, that we want to have less visits at our organization. And we are also looking at personnel challenges. As the baby boomers continue to retire, as we continue to look at less workers, but we are in a labor-intensive market. Half of all of our costs in healthcare are employees.
Mm-hmm.
And so if we're going to be in that situation, we have to get the best, the smartest, and the most useful, employees in the facility at the right time. When I look to our future, though, what I really see, I see the opportunity for us to continue to be a health system. And kind of to Ed's point before, when you look at business and industry, you look at wellness, you look at activities done away from the corner of Brookdale and Hartness. Mm-hmm. This is our home. This is the history. The original building opened in 1954. We're very proud of it. History is huge to us. At the same time, our future is to be in many locations throughout this community. And this community ranges throughout Iredell County, throughout Alexander County, throughout Davie County, anywhere else that we feel is the right spot for us to be to keep patients, family members in our own community. And I think that opportunity absolutely exists for us. It's just figuring out, nimbly, quickly, in each time, what we should be doing and how we should be doing it.
Mr. Rush, as the CEO, will give you the last word.
Well, I would obviously agree with all the things John has said. I think one of the challenges too in the future that all health systems are going to have, if you look at where healthcare is going, so you look at every day, Amazon's getting in healthcare now, Walmart's getting in healthcare now, General Motors is doing direct contracts, Lowe's Corporate right here in Iredell is doing direct contracts with large health systems across the country. So I think businesses see healthcare as two things. Number one, it's too expensive, so they want to get those costs down. John and I understand that, we see that, and we know that's part of our responsibility. But also, they see this as an opportunity. So they're getting into this because they see a chance to disrupt the current market. And I think in the end, I'm cautiously optimistic, I have to be, that disruption will turn to make a better healthcare system. But most industries, when that occurs, that disruption is very challenging to, businesses that have done things a certain way for many years. So our challenge will be is, how do you compete with that? How do we get those costs structured the right way as these market disruptors are coming in? And yet, how do we make sure that you've got a great emergency room that at midnight on a Friday night that you can come to and get the care that you need, and right here locally? And I assure you that those business disruptors, that's not the businesses they're going to be focused in on. They're going to be focused in on those other types of elective, less intense type of healthcare that they can do quickly, get the most revenue for, and move on to different things. So, and that's a piece, that's why when you've been at it so long that you kind of can, that's one of the benefits I have to say. I'm glad I don't have to try to solve that issue, but for the younger people to deal with. But I do think that's going to be a big challenge for the industry, and it's going to hit us here. But I think I wouldn't want to be any place else dealing with that because of what we just said, by our independence and our board. I mean, we can make quick decisions when we need to and respond to the changes in the environment. But
I can't let him end on that. So we have to leave on a little more positive note than that. We are unabashedly nonprofit, community-based healthcare system. And I do absolutely believe, with all of those challenges, we are the best organization for the healthcare of this community moving forward to make sure that we do deal with the challenges of the disruptors, and it will make us a better organization. Will it change us? Yes. Will it be challenging? Absolutely. As I said, I'll say that 10 times over the next 10 years, to employees and forums. But I also am very confident we have 1,600 great minds here. And being nimble includes allowing those 1,600 people to use their skill sets to the best of their abilities to help keep healthcare here. And so we will do that. How is it going to look 10 years from now? I can't guarantee we can answer that, but I can guarantee that he will still be proud of it, and I will still be proud of it.
And so I do get to end it, and I'll be calling him from the beach and saying, how's it going? And he'll be able to update me on that. And I'll feel a lot better then.
Touche.
Gentlemen, I really appreciate it. Thank you
bet.
so much. Mr. Rush, good luck in your
Thank you.
retirement. Mr. Green, good luck with everything you've got on your plate.
Thanks for your time.
Okay, so there you have a good interview with Mike Fuhrman, who sat down with Ed Rush and John Green talking about the plans, the future of Iredell Health System, and also the future of healthcare here in Statesville and Iredell County. So I want to thank their service, I want to thank Ed Rush's service, and also looking forward to wish John Green the best as he takes over as CEO in May. Okay, so there you have it. If you haven't done it yet, go to svlfreenews.com to sign up for your email edition, which comes out every morning at 5 a.m. with SVL Free News, always local, always free. So hope to see you this weekend, and we'll see you on Friday.